Did you know that some common medications can harm your memory and brain? Have you ever wondered if the medications you're taking might be contributing to your cognitive decline? What if you could identify these medications and avoid them, thereby improving your quality of life? Recent research has shown that memory loss doesn't only occur with aging. Some medications, when taken without proper guidance, can have adverse effects on the mind. How can we protect our minds while treating other illnesses? Studies show that proton pump inhibitors, such as omeprazole, and anticholinergics prescribed for conditions like Parkinson's disease, increase the risk of developing dementia. Are we aware of the risks that self-medication entails? This practice can exacerbate these effects. Stay with us until the end, because the seventh medication is the most dangerous, and almost no one knows about it. Let's start from the beginning. For a long time, dementia and cognitive decline were considered inevitable consequences of aging. However, recent research has challenged this view, suggesting that memory loss is not a normal and inevitable part of aging. Dementia and Alzheimer's disease are caused by specific pathological processes in the brain, not simply by aging. Studies demonstrate that it is possible to maintain cognitive faculties and even improve certain skills as we age, provided that risk factors are properly managed. A balanced diet, regular physical activity, mental and social stimulation, and control of chronic diseases such as hypertension and diabetes contribute to brain health. There are also lesser-known factors that can accelerate or worsen cognitive decline. It is known that alcohol abuse, smoking, and brain injuries have a negative impact on brain health. Nutritional deficiencies, especially vitamin B12, as well as psychiatric disorders, also play an essential role. Understanding the underlying processes of dementia has improved significantly. Tau protein and beta amyloid play a key role in forming plaques that damage brain tissue. Genetic factors can also predispose some people to dementia, but lifestyle and environment can significantly modify these risks. Preventing dementia requires a multifaceted strategy that includes promoting a healthy lifestyle, managing chronic diseases, and if necessary, medical interventions. Researchers continue to study new therapies and interventions that may slow down or stop the progression of dementia. Understanding that cognitive decline is not an inevitable aspect of aging can inspire changes to promote brain health throughout life. Memory loss can be caused by a wide range of factors. Among the most well-known are aging and neurodegenerative diseases, but there are also less obvious, yet equally important, contributors. Substance abuse, such as alcohol and tobacco, is a significant factor. Alcohol can cause direct damage to the brain, while tobacco leads to vascular issues that affect brain health. Traumatic brain injuries, often resulting from contact sports or accidents, are another common cause of memory loss. These injuries can lead to immediate damage or long-term cognitive problems, such as chronic traumatic encephalopathy. Strokes are also a major cause, as they disrupt blood flow to the brain, causing damage that impacts memory and other cognitive functions. Insomnia, sleep disorders, and mental illnesses are directly related to memory issues. Chronic sleep deprivation alters memory consolidation processes, making it difficult to retain new information or retrieve existing memories. Chronic stress can also be harmful, as cortisol, the stress hormone, can damage brain structures involved in memory, such as the hippocampus. Memory loss can also be caused by nutritional deficiencies, especially vitamin B12 deficiency. Vitamin B12 is essential for neuronal function, and its deficiency can lead to significant neurological symptoms such as memory loss and confusion. Memory is also affected by psychiatric disorders such as anxiety and depression. Depression, for instance, can lead to decreased concentration and memory capacity, while chronic anxiety can interfere with the brain's ability to process and store information. These factors can be managed and prevented as long as we are aware of their existence. Many commonly used medications can have harmful side effects on memory and cognition, something patients often overlook. These medications are effective in treating various health problems but can also cause side effects, including memory impairment and other cognitive abilities. Let's take a closer look at how some common medications can negatively affect the brain. Widely prescribed to treat conditions like heartburn, omeprazole is a proton pump inhibitor, PPI, a class that also includes lansoprazole, pantoprazole, and esomeprazole. These medications reduce stomach acid production and relieve symptoms of gastritis and reflux. However, prolonged use of PPIs has been associated with serious risks to brain health. Epidemiological studies have shown that PPIs are linked to an increased risk of dementia and memory loss. In a study involving approximately 6,000 participants, 10% of those who took omeprazole for a 3-year period experienced memory loss. In another study, 33% of patients who used this medication for more than 4 to 5 years reported cognitive problems. The connection between PPIs, cognitive issues, and reduced vitamin B12 absorption may be related to the decreased absorption of this essential nutrient. A B12 deficiency can lead to neurological and cognitive disorders. PPIs can also alter gut microbiota, which may negatively affect brain function. It is common for omeprazole to be used without a prescription, but it is important for patients to consult a doctor before starting prolonged PPI treatment. Prescribing these medications should be preceded by a proper diagnosis of conditions like gastritis or stomach ulcers. PPI treatment should generally be limited to periods of 2 weeks to 3 months, depending on the patient's health condition and necessary dietary adjustments. In addition to cognitive risks, prolonged use of omeprazole is associated with other health problems, such as vitamin deficiencies, kidney disease, bone fractures, and an increased risk of respiratory and intestinal infections. To avoid long-term complications, it is important to use these medications under strict medical supervision and with caution. Anticholinergics have been widely used to treat various conditions, such as Parkinson's disease, overactive bladder, and respiratory disorders. They work by blocking acetylcholine, a neurotransmitter essential for many bodily functions, especially memory and learning. While these medications are effective, they can have side effects on the brain, particularly when used for long periods. Studies show that anticholinergics increase the risk of dementia and other cognitive disorders. The University of Washington conducted a study that followed more than 3,500 elderly people over 10 years and found that those who regularly used anticholinergics had a 54% higher risk of developing dementia. This risk increases with the dose and duration of use. Anticholinergics commonly associated with cognitive decline include meclizine, scopolamine, atropine, piperidine, oxybutynin, trihexyphenidyl, and diphenhydramine. These medications, which block acetylcholine, interfere with neuronal communication, altering learning and memory processes. Anticholinergics such as glycopyrrolate, trospium, tolterodine, darafenacin, fesoterodine, aclidinium, tiotropium, and umeclidinium, particularly when administered by inhalation, have not shown these cognitive effects. It is alarming that these medications are used indiscriminately, especially among the elderly, as they can contribute to cognitive decline. Patients and doctors should carefully weigh the risks and benefits associated with anticholinergics and seek alternatives, limiting their use to the minimum necessary doses and durations. Anticholinergics are not only associated with cognitive risks, but also with other side effects, such as dry mouth, constipation, and vision problems. It is important to be aware of the risks associated with these medications, especially for vulnerable populations like the elderly. These powerful medications are used to treat a variety of conditions, ranging from allergies and asthma to autoimmune and inflammatory diseases. However, corticosteroids are associated with serious side effects, including impairment of mental and cognitive health, especially when used long-term, particularly if taken orally. Studies have shown that corticosteroids can cause structural changes in the brain, which may lead to disorientation, anxiety, depression, or confusion. A British epidemiological study that analyzed data from over 500,000 individuals found that those who took corticosteroids long-term to treat asthma had a higher risk of developing dementia or other mental disorders. Prolonged use of glucocorticoids, such as prednisone or dexamethasone, is particularly dangerous as it can affect brain function due to changes in cortisol, a stress hormone that, when used in excess, can damage neurons in the hippocampus region of the brain, which is responsible for memory. Even inhaled corticosteroids, like fluticasone and budesonide, can have negative effects when used in high doses or over an extended period. In addition to cognitive risks, prolonged use of corticosteroids is associated with other undesirable side effects, such as osteoporosis, diabetes, hypertension, and increased susceptibility to infections. It is important for healthcare professionals to closely monitor the use of corticosteroids to minimize these risks. Patients should be informed about potential side effects and encouraged to use the lowest effective dose for the shortest possible time. Non-pharmacological strategies and alternative therapies should be considered whenever possible to reduce dependence on corticosteroids. Understanding the effects of corticosteroids on cognitive and mental health can promote safer and more informed use of these medications, protecting patients from long-term complications. Benzodiazepines are a class of medications widely prescribed to treat insomnia and anxiety. These drugs, including alprazolam and diazepam, are known for their calming and relaxing effects. While they can quickly alleviate anxiety symptoms, long-term use can cause serious harm to the brain. Studies show a clear link between benzodiazepines, memory loss, and prolonged use. These medications can double the risk of developing Alzheimer's disease, possibly because they cause permanent brain damage. In one study, more than 40% of people interviewed reported experiencing various neurological symptoms, including lack of energy, nervousness, difficulty concentrating, and memory loss. Long-term use of benzodiazepines is associated with other adverse effects. Potential side effects include sleep disturbances, anxiety, muscle weakness, and myalgia. Physical and emotional dependence is another significant risk, making it difficult for many patients to stop using these medications. The connection between benzodiazepines and Alzheimer's disease is of particular concern. Although the exact mechanism is still unknown, it is believed that these medications may interfere with the normal function of neurotransmitters, resulting in structural or functional changes in the brain. Additionally, prolonged use of these substances can negatively impact the sleep cycle, which is crucial for memory consolidation. Given the severity of these risks, it is important to limit and carefully monitor the use of benzodiazepines. In cases of anxiety and insomnia, doctors should consider non-pharmacological treatments, such as cognitive behavioral therapy, relaxation techniques, or lifestyle changes. If benzodiazepines are necessary, they should be used only for a short period and at the lowest possible doses. Awareness of the risks associated with prolonged benzodiazepine use is essential to protect patients' brains and promote safer and more effective treatment for anxiety and insomnia. Amphetamines are widely used to treat attention deficit hyperactivity disorder, ADHD. These medications are well known for their ability to improve short-term concentration and reduce excessive hyperactivity. However, amphetamines are addictive and can cause memory loss if consumed over long periods. Amphetamines increase the levels of neurotransmitters in the brain, such as norepinephrine and dopamine, which temporarily enhance concentration and attention. However, continuous use can lead to a range of problems, including physical and emotional dependence, sleep disturbances, irritability, and even depression. Memory loss is one of the most severe side effects of prolonged use of these medications. Studies show that consuming amphetamines in high doses and for extended periods can cause permanent brain damage. Long-term users may experience memory problems, along with decreased motivation and cognitive performance. These effects may persist even after discontinuing treatment, indicating long-term damage. Amphetamines also pose a significant risk due to their potential for abuse or dependence. These medications are often misused for their stimulating effects, which can lead to serious complications, such as cardiac arrhythmias and digestive problems. Psychological dependence is another issue that can make it difficult to stop using the drug, even when side effects become apparent. It is crucial for healthcare professionals to prescribe and monitor the use of amphetamines to minimize risks. Patients should be informed about potential side effects and advised not to exceed recommended doses. ADHD treatment should include non-pharmacological approaches, such as behavioral therapy or stress management techniques. Amphetamines can be harmful to the brain, so it is important for patients to be aware of the risks. First-generation antihistamines, such as diphenhydramine and chlorpheniramine, are widely used to treat allergy and cold symptoms. These medications are effective at relieving symptoms like congestion and itching, but they have a dark side. Over time, they can negatively impact memory and cognitive functions. These antihistamines block the action of histamine in the body, which is responsible for allergy symptoms. They also have anticholinergic properties, meaning they block acetylcholine, a neurotransmitter essential for memory and learning. These medications can cause cognitive decline if used for prolonged periods. Studies have shown an increased risk of dementia with the use of first-generation antihistamines. A recent review of 138 articles on adverse effects found that prolonged use of these medications was associated with cognitive decline. Patients who regularly use these drugs reported memory problems and difficulty concentrating, even after stopping them. Less harmful alternatives, such as cetirizine and loratadine, which are second-generation antihistamines, have fewer side effects and do not cause cognitive decline. These medications are preferred for long-term allergy treatment, as they effectively relieve symptoms without posing the same risks to brain health. First-generation antihistamines can also cause side effects like drowsiness and blurred vision. These effects can significantly impact quality of life, especially for elderly people who are more susceptible to these adverse effects. It is important to consult a doctor before taking first-generation antihistamines for an extended period. Considering safer alternatives and other methods to manage allergies, such as dietary and environmental changes, can reduce the need for these medications and protect cognitive health. Amitriptyline and nortriptyline were among the first antidepressants developed to treat depression. These medications are effective in alleviating depressive symptoms, but they also come with side effects, including memory loss and other cognitive issues. These antidepressants increase the availability of neurotransmitters like serotonin, norepinephrine, and dopamine in the brain by blocking their reuptake. They also have potent anticholinergic effects, meaning they block acetylcholine, a neurotransmitter essential for memory and learning. Tricyclic antidepressants are associated with an increased risk of dementia and cognitive decline. Patients who regularly take tricyclic antidepressants experience a faster decline in cognitive function compared to those who do not take them. These medications can cause confusion, difficulty concentrating, and memory loss in both the short and long term. Elderly individuals are especially vulnerable to these adverse effects as they are more sensitive to the anticholinergic properties than younger people. Today, safer alternatives exist, such as selective serotonin reuptake inhibitors, SSRIs, which have fewer side effects and are not linked to memory problems. Sertraline and fluoxetine are two commonly used medications for treating depression and anxiety and have a better safety profile. Tricyclic antidepressants can also cause side effects such as dry mouth, constipation, and blurred vision. These side effects can negatively impact patients' quality of life and, in some cases, lead to the discontinuation of treatment. It is important for doctors and patients to carefully discuss treatment options, considering both the benefits and potential side effects. Tricyclic antidepressants should be closely monitored in vulnerable populations, and whenever possible, safer alternatives should be considered. Statins, such as simvastatin and atorvastatin, are commonly prescribed to lower cholesterol levels and prevent cardiovascular diseases. Statins are effective in protecting against strokes and heart attacks, but there is growing evidence that prolonged use may have undesirable effects. According to studies, some statin users experience memory problems and mental confusion. These side effects, although rare, can have a significant impact on those who experience them. It is believed that statins may interfere with cholesterol production in the brain, which is important for synapse development and cognitive functions. A review of clinical trials and observational studies found mixed results regarding the relationship between statins, cognitive function, and memory. Some studies suggest that statins may protect against dementia, while others show a higher risk of memory problems. This discrepancy may be due to differences in the population studied, statin doses, and treatment duration. Statins can also cause side effects such as muscle pain, weakness, and digestive problems. These effects can affect patients' quality of life and, in some cases, lead to the discontinuation of treatment. It is important for patients and doctors to discuss the potential side effects of statins and closely monitor any cognitive symptoms that may arise. In some cases, switching statins or adjusting the dose may help reduce adverse effects. Patients should also be encouraged to adopt a healthy lifestyle, particularly in terms of diet and physical activity, to reduce reliance on medication and manage cholesterol levels. Understanding the potential side effects of statins is crucial for making informed therapeutic decisions and protecting patients' cognitive health. This article explains how common medications, such as omeprazole and anticholinergics, can harm the brain over time. Patients should always consult their doctor before starting or continuing any treatment for cognitive health. In general, it is important to have informed discussions about the risks and benefits of medications and to explore safer alternatives.